right, I'm here. This is Dr. Jerry Cuomo. I'm here with my class. We're recording live, and I'm going to go ahead and start my root canal therapy. This is part of session 7, and this is the demonstration. So we're going to operate at a higher power now. I'm going to be up around, let's see, we're right about 8 power. So my axis is going to be right in the central groove area in the middle of the tooth. Let's make sure this is our endo-treated tooth. Okay, so you know you've got 2 canals. I did instruct the class that we're going to mark the buccal. I'll just put a little dot so I know that this is my buccal side of my tooth, just to mark it. All right. Now, slow power. I'm going to stay in the long axis of the tooth. This is a tapered burr. So I'm going to go ahead, and the first thing I'm going to do is look at what I've just done. Going a little bit more. I'm right about 3 millimeters now. Okay. And as soon as I see something turn red, I'll know I'll be approaching the pulp. Now, the company actually has made this pretty close to that of the human tooth, human bicuspid. So I'm going to keep going until I discover I'm going to be at the roof. Now, I'm now almost 6 millimeters. Okay, and if you look real close, you can start to see it's getting a little pink. Now, if I'm starting to just discover this for the first time, I might want to take my endodontic explorer and just go ahead and try to punch through that thin roof. So let's see if it goes in. Yep, it did. So I punched in, and there, lo and behold, is the first part of the root canal chamber. Okay, so now I'm going to take my burr and slot it and try to extend it, go buccally and lingually, and then start to create an oval shape. The oval shape mimics that of the anatomy of the root canal chamber, the first part, where the horns are located. So you got 2 horns located, and then you'll see that the roof slopes from one horn to the other. So in you go, stay with the long axis of the tooth, and just start slotting it. I'll try to go straight lingual. Okay, and then turn it around and just bring it to the buccal. Now, some of you might start going back and forth, creating the oval. Sometimes you go off the road a little bit, don't worry about it. And you'll think, well, is that the base of the root canal, or is that the, you know, did I go far enough already, or is that the orifice? I would measure that. If you're about 6 millimeters, you still got a ways to go. And so that would be your, can I have another Explorer pigtail? So now you take out your regular Explorer, and on the end of it, let me have one more that has a little pigtail on the end of it. You get the one that has a little, and you start to feel the roof. I just want to demonstrate that. Let's try this one. I think that should do it. Yes, this is it. Okay. So if you send this in there and actually turn it a little bit, you'll get underneath and you'll lock underneath the roof. See how I demonstrated that? So now you know that that has to be cleaned out. So I'm starting with my oval shape, and I'm going low power again. Bring it in a little bit more. Let's take the roof off, all right? Okay, so I'm careful not to go too far in, because I don't want to cause any problems internally. So it's very quick to go in and create this oval shaped access hole. You don't want to be too conservative, yet you don't want it too big. So think about it, you know, as you're creating the ovalness. Now, the next step is once you're in there, you have to feel for ledges. So you take your Explorer again, And you start just feeling now for the horns and the ledges. I'm going to feel for all those. So I've got a few here. I got one there. I got one there. So let's do this. I'm going to just increase the size of this. There. And there we go. Okay. So getting rid of my ledges, that's the next step. I might feel more comfortable now in switching to my diamond burr, because now I know that the diameter of my diamond, and the diamond is a coarse instrument in itself, so you'll probably get a little more cutting action in there. So we'll change your collets, change your burr. Let's put that all together. Let's see if that goes in like so. Again, I'm holding with my finger, tightening that down. Going to come right back in, low speed again, nothing too heavy here. Okay. Incidentally, the only specialty where it's mandatory to use the microscope is endodontics. So if you go to root canal school, you need to learn how to use a microscope and use it every day because it's mandatory. All right. So here's my, you see I just gently, you can turn your tooth the other way. All right. And now I'm getting rid of a pulp horn. And this one. So you can see the access is not just, it's not just, creating a hole. You have to get rid of compartments, different compartments within the chamber itself. See, I can still almost, well, actually that feels pretty smooth right there. That's pretty smooth. That's the buccal. Here's the distal. I got a ledge on the distal. And I got a little ledge on the mesial. So I'm going to just take my burr and very gently go in there. It's almost like you're an eye surgeon now, right? And just smooth that wall a little bit. And come in here and smooth that wall a little bit. Okay. I think that's pretty good. All right. So step one, we'll check that one off. That's our access made. You want to hit that with air again? Okay, you can see how much air we go through. Now look at, there are the two orifices just sitting and waiting, so we've got to measure them, right? So what did we say the first file was called? Pardon me? The purple one, yes. That's the number 10 file. And on each file you'll see there's a blue color stopper, or a file stopper, and it's right here. Now, the other thing you're going to need to have is your ruler, your little measuring device. Okay, so one side it's all inches, the other side it's meters, or millimeters. So I'm going to suggest be careful. Don't stick your finger out the end here and think you're going to push that way. You'll go right into your finger, and then you'll need neosporin. All right. Take a look at your tooth first. You're going to notice that one cusp is taller than the other. So if I'm going to measure my working distance for my buccal cusp, I'm going to probably come up a little bit longer because see my lingual cusp is a little shorter, and that's the way it is in nature on tooth number 12. So the first thing I'm going to do is just push this in, and my measuring landmark is going to be my buccal cusp for my buccal canal. So I'll push that in gently, move the stopper, push it in again. Okay, so here's your first measure, and it's the most important one. that you can measure. You want to get the working length. So the total length of the tooth from the buccal cusp to the end here minus a half a millimeter or quarter millimeter to a half a millimeter is going to be your working length. So we're going to create an apical constriction by measuring the total length. So let's do that. Okay, so I'm out the end, I pull it back, I measure it, that's my mark. I take my ruler, and I'm on the metric side, right? And I'm going to measure, looks like 20, exactly 20. So I'm going to take 20 and I'm going to call my buccal 19.5. Okay, so my buccal working length is 19.5. Yours might be 19. It may be 18 and a half. I don't know. All these are a little different, so that's something for you to discover. I'm going to do the same thing for my lingual cusp. Okay, and I'll measure that. Now, if I find I'm really tight in here and I'm not going all the way through and it's just binding, then there's something wrong, and you might have cut through to the side. You might be creating another canal. So if that happens, stop one of us. We'll come by, take a look. All right. And so I'm not going to measure my lingual canal. I'm going to let you do that. All right. I'm going to show you what's going to happen next. So this is also something called your patency file. This is the file you'll go back to check to make sure there's no blockage. So you can send it through the apical constriction without ruining the anatomy of that, just to make sure you're patent. Patency is a term that we use to make sure that there's no blockage and that you're communicating with that infection and allowing it to drain, you know, through the canal. Because most root canals that are done have infection related to them, and not many root canals are done in one appointment. And it usually takes 2 appointments, one to cleanse and shape, and the second one is to fill. Patients are usually put on antibiotics and for at least a week, and then they're asked to come back for the final fill. And most endodontists will want to see a dry canal when they go to fill it, and free of any infection. So you're cleansing and shaping a tooth, whether you realize that or not, and you're not only removing the decayed matter in the tooth, but you're creating a channel for the infection in bone to go. And sometimes they'll leave an orifice open if it's draining a lot, and then they'll come back and close it after the antibiotic is kicked in, because you might have pus coming up from this and bacteria. So that happens quite often as well. So it's really interesting to the anatomy to find out, hey, I can find little things in there in the amount of detail. Try that again. Okay. Okay, so you can see there was some debris in there. How do we make sure we don't get that debris caught in any of the canals? Well, this is a lubricant. You put 1 drop of the lubricant in there. That's more than a drop. So you just suck it back in there. That's no problem. All right. And then you take your file, your next file, which is a number 15. And that number 15 has a yellow stopper in mine. So I said, well, it was 19.5, right? Well, let's measure it before we put it in there. Let's go to 19.5, and this is the, not inches, it's, okay, so that's 19 and a half. Come back to my buccal cusp. I marked it. I send this all the way through. Does it pass out the end? It does. So that apex is larger than a 15. So I learned that. There's no resistance. So this one's coming out. I'm going to put that one back. I'm going to take my patency file and recapitulate and back step. I'm going to go right back in, push it in there, recheck it, no problem, it's patent. Put that file back. Go to the next one, which is a number 20, which is yellow. Do the same thing, measure it. See how I'm back stepping now? What's the next file after a 20 going to be? Anybody? Number what? Okay, well that's the next one up from it, but what's the next one I'm going to pick up in my hand? A 10, the patency file. You want to always make sure you're patent. As soon as you're blocked, you got to get through the blockage. Otherwise, you're going to hurt the tooth, and you're going to cause a blockage, and the infection is not going to clear up. It's okay, so that's 19 and a half. I go right back in place. And you can see, you know, obviously my apical constriction is a little more open than I thought. See, now my 20 is passing through there too. So keep going. Go back to my file, my patency file. Before I do that, lubricate it. So I would lubricate every time you change and go up to a next file. I would lubricate in there. It's just a safety thing. And then just make sure you're painting. So go in your file and you get your all the way through, no problem. Okay. I'm going up to a number 25, so that's red. And normally under red, whenever you get to a red file in the mouth, you want to think flaring. We want to flare. We don't want to create this Washington Monument. I want it to be a funnel shape. Our typodont teeth are a little bit larger, so or maybe they're on a younger patient whose apex didn't close all the way. Maybe we have to create that. Sometimes on a pediatric patient, they have an early root canal where you have to close the apex, and what they'll do is pack the apex with calcium hydroxide, and under natural causes, the apex will close with the stimulation of coming from the calcium hydroxide. So this one is pretty good. Let's stop for me. So I'm going to take that back. I'm going to say, okay, this one is the start of my apical constriction. It's the red color. So I'll put that down. I want to check patency. It stopped right at that level. And I'm going to go back, check my patency. You know, maybe put a little bit of lubricant in there too before I do that. And then put that back. So notice I'm also putting them right back in here because the sponge acts as a cleaner. So you can see. This is what those files look like blown up. See how it's wire or metal that's just twisted, and on the end is where you're cleaning the tooth. See the little debris on the end of that? That's what you're getting out of here. The walls of this are very sharp as well. The twist of this metal cuts also on the side, and many endodontists will flare more by just using the side of the file. Today they're all rotary. Okay, so I'm up to a 30 file, and now you see where I'm getting. Now this is I'm going to kind of push this in there, but not push too hard. See where it stops. This one stopped there. Let's just see if I'm close. Measurement. All right. It's down about a 17, so let's just see. That may or may not be true. So I'll push it down a little bit more. It stops right about there. And no, that's where it stopped. Right about there. Okay, so I'll make my turn to the right, quarter turn, and then about 3/4 to the left, pull out, check for debris. You know, and you won't be able to see this, but you see the red debris here with the microscope, and that means I'm cleaning the side of that canal. So then again, what's the file we use? The number 10. Exactly. I'm going to go back in, maybe lubricate a little bit. I'm painted all the way through. So now you can see I'm starting to create my apical constriction, and I'm already up to a number 35. By the time you get to a 40, you're going to be finished. It's very easy to push a 35 or a 30 through the apex. See, now I got a lot of resistance. So what happens when a 35 file is caught like that? And you know you're pretty short. That's pretty short, considering that's where my file ends. So I want to show you one thing later. I'll show you on the chalkboard of why that's occurring. There's a certain amount of constriction that you'll find in the middle of the root canal itself that needs to be flared. So don't think you're going to create it near the apex. Try to remove some of that debris from the middle of the canal itself by simply taking it and just pulling it up on the side, quarter turn, and pull out. You see the debris is at the mid portion of your file, not at the tip. And so you're funneling and you're creating this funnel shape. That's the goal. All right, and then you get to a point where you've reached the end and you have that checked off. Now you want to go in and create a post space. Again, you'll have to change your collet back to the number 3 collet. And in your kit, you're going to have 2 sets of burrs. One is called the GG burr. Actually, 3 sets. I'm going to borrow, the GG burrs have a round knob to the end of it. So you have a GG2 and a GG3, and they're marked. This is the 3. The end of it is a knob shape. Looks like that. The piezo drill is more slender. Looks like this. The piezo has the same dimension widthwise as that of the post that you're going to be inserting. So let's take a look at the post. This is your post. It's plastic, it's smooth, and it's not tapered. If it's like we're violating now everything I've been trying to teach you about taperedness. Now we're going to make a post drill, but we're going to make it straight. This is the number 3 post drill. It's a piezo. It has almost the same diameter of that as the post. The final post drill is going to be what we call a parapost drill. And again, you need to know the length. This is diameter of this post, which is color code red, is a little bit wider than that of the post, just a little bit, slightly, allowing for cement to go around the post. And what we normally put in the mouth is a metal post. This is plastic for practice. All right? And that has to go all the way down on the lingual side of the tooth. So I haven't reamed out, I haven't cleansed and shaped the lingual canal, but for this demonstration I'm going to go right to drilling post room so you know how to do that. And then we're going to turn you loose. Okay. I changed my collet, my first. So this is where you want to use a lot of lubrication. These post drills are very easy to snap and break, so you want to be very careful using them. So I recommend definitely lubricating first. So drop in your lube. Suck back a little bit out of there. Okay, so how do you measure 2/3 the distance? Well, you measure the length of your tooth, and then you mark. You're going to have to mark your burr with your Sharpie. So measure the distance, and we'll measure that. 2/3 the distance. I'm going to guesstimate 14. Okay. So from the tip of the lingual canal now, let's see, that's going to put us right about there. So take your burr and your Sharpie, go ahead and measure 14 from the end. It looks about 12. Okay, so we're about 12. I think that's what we marked. 2/3, okay, of the length. Put your Sharpie marker there. And you might as well just go ahead and do it on all your burrs. Just line them up, mark them all. This one was marked, that one was marked. Okay, you get the idea. I'll just get through this and you can get going. There you go. All right, again, low power. Now, why the GGs first? Well, the knobs go in better. They're easier to seat. Makes life easy. Go on in. Well, you find out, watch, the 2 went in fairly easy. No problem. Turn it off, lubricate. Be careful, because you both have to use these. You want to bend them. And we'll take our piezo. And of course, I'm just going to hop right to a number 3 just to demo this for you. But you'll go from the 2 to a 3. Lingual canal again. All the way in. So you're passing it down right about here. I'm going to go a little bit further. I like 14. Okay. That's well lubricated. Just try that again. Go right in there with the tip. Yeah, there you go. Okay, you can see I'm going down that way. All right. Now the last thing you're going to use is the post drill. If you can't find a red one out there, I think we have some that are not color coded, but the diameter is right, so we can measure that for you. Okay. And here we go. So I'm going to go ahead in my lingual canal. Feel it binding a little bit. Make sure I'm going about 2/3. Right about there. Again, I'm going to lubricate. A lot of debris in there. And at this point, I could not check the patency because I don't have it filled, and I don't, there's debris going down into the end of that canal. But normally you would have it all sealed with gutta percha, which is the root canal sealing material. So there's your, all right. So then we turn this off. Now you want to dry that thoroughly. I go ahead and get my post, insert it. That fits nice without any resistance, and if there's a little bit of resistance, you got to go back in. So my post is right about there, 2/3 the length of the tooth. All right. Did anybody fall asleep? All right. Well, good luck, and if you need help with any part of this, feel free to ask myself or one of the TAs. All right. Very good.